topic of discussion in today's video is the POPQ system, that is the pelvic organ prolapse quantification system. Whenever there is genital prolapse, we usually use the Shaw's classification to tell whether it's a cystocele, rectocele, and then we grade the prolapse, but that's a very subjective method. So the POPQ system was developed to make the method more objective for classifying or quantifying the degree of prolapse. In the POPQ system, it's basically based on a reference point. The reference point used in the POPQ will be the hymen. So the hymen is taken as reference point. If this is the hymen, anything proximal to it will be taken with a negative value, and anything distal to it or outside it will be taken with a positive value. So if I tell any value as a plus 3, that means that it is plus 3 centimeter distal or outside the hymen. So the reference point here is the hymen. Next important thing is the POPQ system is mainly based on a grid, that is a 3x3 grid. Every box in this grid refers to a specific point, so you cannot interchange values from this box to this box or this box to this box. First we'll come to know what are the different points in each box of this grid. For easy remembrance, you can in the first row write an A, a B and a C, then write an A, a B and a D. Here you write a G, a P and a T. All the values in the first row correspond to points with related to the anterior vaginal wall. In the last row correspond to points with respect to posterior vaginal wall. So, because the first row points are related to anterior vaginal wall, the first point can be written as AA, that is point A on the anterior vaginal wall, point B with respect to anterior vaginal wall. Similarly, point A on the posterior vaginal wall will be AP, BP. What is this G? G is GH, that is the genital hiatus. P is PB, that is perineal body, and T is TVL, that is total vaginal length. So these specific points are specific to that box. If you write any number in this first box, it always means with the point AA with respect to anterior vaginal wall. It cannot be total cervical length or anything. So the C is the relation of the cervix to the hymen, the most leading point on the cervix, and D is the relation of the posterior fornix. Now that we know which point is what on the grid, let's find out what these points are. First we'll focus on the middle row. So for that we need to draw a schematic diagram. This is the urinary bladder. This is the uterus. This is the rectum. Usually whenever we see diagrams of this schematic diagram, we always see the uterus in an anteverted position. Why have I drawn it in this way is because it makes me easier to find out what these points are, to demonstrate these points. And second thing is that an anteverted uterus does not prolapse, and any prolapsed uterus is not anteverted. So this diagram makes a little more sense. Firstly, we'll find out what the middle row points are. GH is the genital hiatus. It extends from mid point of the external urethral meatus till posterior part of the hymen. This is GH. Next is PB, that is from posterior hymen till middle of the anus. And total vaginal length is this, that is from the hymen till the posterior fornix. This is TVL. So these are the points on the of the middle row. Now coming to what are the fixed points A, B, C, D. Again we draw the schematic diagram. The uterus, and the rectum. You should know that the point A is a very fixed point. So it's a fixed point on the anterior vaginal wall, which is 3 centimeter proximal to the external urethral meatus. This is my point AA. So why is this 3 centimeter taken from proximal to the external urethral opening is because this, in a normal anatomical position, this corresponds to the uretrovesical junction. Similarly, a point which is 3 centimeter proximal to the hymen on the posterior vaginal wall will be AP. See, this point A, the point A, that is AA and AP are both fixed points. So, these can be measured or should be measured first. After you completely reduce the prolapse uterus, you mark this point AA on the anterior vaginal wall, that is 3 centimeter, and you mark this point AP first. So first this has to be done with respect to, after you completely reduce the prolapse uterus, mark these points, then ask the patient to cough, and then find out the relation of this point with respect to the hymen. So this is AA and AP. Next, coming to what is the point B. Point B is nothing but, it is the most distal part of the prolapse with respect to the hymen. So BA will be with respect to prolapse on the anterior vaginal wall. BP is the most distal point on the posterior vaginal wall. In a non-prolapsed uterus, the points AA and BA will be coinciding in a non-prolapsed uterus. Similarly, the point AP and BP will be coinciding in a non-prolapsed uterus. So these will be measuring 3 centimeter. And because you are telling with respect to the hymen, this will be at a -3 level. Similarly, this will also be measuring 3 centimeter. This will be at a -3 centimeter. Now only you should understand that after prolapsing, the values of AA can extend from -3 to +3. Similarly, AP can also go from only -3 to +3. So this is point A, B, BP and AP. These are fixed points. You should remember that. First you mark the points -3 centimeters proximal. Then you ask the patient to cough. Then you see where this point comes with respect to the hymen. So this is related to middle row and points A and B. Similar diagram, once again we draw the bladder, the uterus and the rectum. Our last 2 points which are remaining are point C and point D. Point C is the leading point on the cervix. That is when there is a prolapse, which part of cervix is more distal, that point we take, and with that with respect to the hymen we measure it. That will be the cervix, that is point C. And point D is the relation of the posterior fornix to the hymen. Now that we have seen what all points correspond to what, you should remember certain points. If there is no prolapse, then AA will be -3 centimeter. AP also will be -3. Similarly, because the points B are corresponding or coinciding with points A, your BA and BP will also be at a -3 level. Okay? And in a hysterectomized patient, There's only one value which we don't write. There is no point D. All other points will be there. So you should remember these points. Now we'll take one example to see what is happening so far. We'll take a very simple example. Now this is the urinary bladder. Now consider a hysterectomized patient. This is when it's completely reduced. The prolapse is completely reduced. This is my point AA, AP. Then here is my point B, A, BP. Now you ask the patient to cough or do a Valsalva maneuver, and if this is what happens, initially it was this position, now this has totally come out like this. This is your hymen. So your anterior AA, which was initially here, is now here. AP is here. This is the cervix. Cervix is here. Okay, this was your total vaginal length before. In this case, your AA can go, remember, AA can go maximum only up to +3. So this will be 3, this will be 3. See, your C will be equal to your total vaginal length. Imagine if the TVL was around 8 cm, if the PB was already given to be 4, and if your genital hiatus was 3.5, then the grid for this prolapse would be something like this. So first box with respect to AA, this will be +3. Okay. The second box is BA. See, BA is somewhere here. This is the most leading point. So because it is the most leading point, it has completely come out. It will be around +8. Cervix is +8, completely come out. Then your GH is given to be 3.5. Your PB is given to be 4. Your TVL is already given to be 8. Your AP will be again a +3. Then your BP will be an 8, and your D, there is no D here because it's a hysterectomized patient. So these are some of the points with relate to the POPQ system. Hope it was useful. Thank you.